So I am Tanya Anim-Fowler. I'm one of the core faculty at the FSU Family Medicine Residency Program at Lee Health in Fort Myers, Florida. I've been here for about 2 years, and before that, I was at the University of Florida as faculty for about 4 years. So it's been an interesting journey as an attending in the residency program. It's a lot of fun, and I really enjoy teaching. And of course, with teaching comes scholarly work. And so that's what I'm here to talk to you guys about today, and how to combine both your passions with your scholarly work as faculty. Says my audio is a little choppy. Let me move my microphone around and see if that helps. How is that? Does that sound a little better, probably? Kind of, sort of, but not really. Okay. All right. So these are the objectives for the presentation today. We're going to talk about what the ACGME requires from faculty in terms of scholarship. I want you to be able to actually think about what your passions are when it comes to your scholarly work, because I want you to actually enjoy the things that you're writing about. Don't just do scholarly work for the sake of doing something to put on your CV, but actually do things that you really enjoy and are passionate about. And then start to think about actually creating manuscripts, creating posters, and getting your ideas together for things that you want to do. All right, so get back out of here. So let's talk about the ACGME. So the ACGME, is, of course, as you know, is our governing body over residency programs, and they have a certain amount of things that or a certain requirement for faculty to be scholarly in their work. And so what we normally think about is papers and peer-reviewed publications and doing posters and that sort of thing. But it doesn't just include that sort of work. So definitely you want to look at being able to submit papers. And of course, like I said before, you want to think about things that you're actually passionate about. So if diabetes care is something that you are really passionate about, then that is excellent. And that's something that you can definitely get published. But there's other things that we don't really think about very often as being scholarly that are part of our everyday jobs that you can then also turn into scholarly work as well. So what are some ways that we can do that? So some of the activities that are counted as scholarly activity and scholarship in by the ACGME are things like, of course, research projects, of course, grants, our quality improvement projects. So if any of you are, for example, the medical director or over quality improvement for your clinic, every single thing that you do for quality improvement are things to improve your workflows in your clinic. Those are things that you're going to be doing anyway, and you can easily turn those into scholarly projects as well. So it's not that you need to do more scholarly work on top of the things that you are already doing. The things that you are doing are scholarly. It's just a matter of writing those things up. Some other things that are considered to be scholarly activity is creation of curriculum. So if you're doing something new and innovative for your residency program, think about writing that up. If you are developing a population medicine curriculum, something that your residency program has not done before, and you're adding something new to your curriculum, think about writing that up. That's something that you already enjoy, something that you are already passionate about. So you don't have to then go out of your way to find something just to put on your CV or just to find something to be adding to your scholarly work. You are already doing scholarly work. So just make sure that you're taking notice of it and writing those things down. What if you're creating an electronic module? You like, for example, we're all going to all of this electronic meetings, and I know when we had the coronavirus pandemic first start, a lot of our residents suddenly were being pulled from a lot of our community preceptor rotations and having to do a lot of online modules. So how did we change those rotations to be able to accommodate them? So writing that up, how did you uh, accommodate your residents now having to do things more virtually or doing a whole lot more telemedicine? So those are things that already had to be done. So let's write those things up and make sure that we can produce some scholarly work from those. So in addition to those more traditional things of writing papers, um, there's also just being active in your academy, in organized medicine, and those things also count as scholarly work by the ACGME. So if you want to be involved in, for example, STFM, we're always looking for people to do wonderful things in STFM. So join our committees and get involved. And that also counts as some scholarly work. Getting involved in editorial boards. So, for example, editing for the STFM journal, Family Medicine, or the ACGME journal, the JGME. These are all opportunities to do scholarly work that's not sort of the things that we normally think of when we think of our faculty scholarship, but are definitely in those categories. And then any innovations in education. So, like we said before, coming up with new ways to teach things and redeveloping some of your curriculum and things like that. Doing something completely new. One of the things that the ACGME did with our most recent iteration of um, program requirements is to allow for programs that are in good standing to do innovation. So you don't have to do things the way that they've always been done in order to achieve the same outcomes in terms of educational quality of your residents. If you can find a new way to do something that still teaches them the exact same, like um, uh, the same curricular component, then you can definitely do that. So that's the whole importance of having something that's a core versus an outcome. For example, when you look at your ACGME requirements, so is it core? Is it has to be done and it has to be specific like this, or it's really just the outcome of making sure your residents still meet the same intent without doing it exactly as it's spelled out in the requirements? All right, so now that we know all the things that count as scholarship, let's also talk about advocacy. So there's lots of different ways to be an advocate, right? So we often think of being a patient advocate, for example, or being an advocate for our specialty. And these are great things to think about, and it's definitely a great idea to get involved with various organizations. So you can do those things on a local level, or you can do those things on a national level. So when we're thinking about working on our local level to be an advocate, we can look at things like population medicine or addressing social determinants of health, addressing systemic racism, and so many other things that you might be personally passionate about that you may or may not think relate directly to medicine, but certainly do have an impact on our patients and how our patients get their health care, have access to health care, experience health care. So if you have interest in anything that is like that, or not just racism, but sexism, other inequities in health, those are areas that you can not only be an advocate in, but then you can also turn those experiences into scholarly work, which we'll talk about in a minute here. So, how about getting involved on the national level? So, there's, of course, many different organizations within the family of family medicine that you can become more involved with. And some of it is more what you think about when you think of the word advocacy. So, for example, getting involved in government relations, especially through like the AMA, or being part of the Governmental Advocacy Commission for the AAFP, so on and so forth. But there's other ways for you to be an advocate. So if you are, for example, involved in STFM, and you are involved in, let's say, the reproductive health committee or community on STFM Connect, then you can use your activities through that committee to then advocate for patients, advocate for other family physicians who want to do more reproductive medicine, or for patients that need access to abortion care. There's all kinds of things that you can do to be an advocate that combines your experience in organized medicine with also being an advocate, and then taking that same thing that you're already passionate about and turning it into scholarly work in the more traditional sense, such as papers and outcomes and things like that. Okay, so when we talk about scholarship, we talked about there's so many different ways that we can see scholarship, and one of the things that's really important for you to know is not only what the ACGME counts as scholarship, but to know what your institution counts as scholarship, especially when it comes to applying for promotion. So there's different categories usually about where different things fall. So for example, being involved in organized medicine might count for scholarship for the ACGME and for what your program director is going to be putting into web ads, but it might not count towards your scholarly production for the purposes of your getting your promotion to your next rank, from going from assistant professor to associate professor, for example. So you really want to be familiar with what exactly your institution counts as scholarly work, as opposed to, for example, service. So they might count your involvement in on committees and things like that as service, but not necessarily scholarship. And you might need to earn a certain amount of points for scholarship in order to earn your next promotion. So just make sure that you're aware of that. So a poster presentation might count, lectures that you might do at AAFP, at FMX, or at the STFM annual conferences. Those usually will count towards your scholarly production for the purposes of promotion. And then, of course, publications, particularly peer-reviewed publications. And so this is kind of the sort of hierarchy that we think of when it comes to those types of more traditional production, scholarly productive works, and how they normally will count towards your promotion. So just make sure that you're familiar with what your institution really counts. So, all of that being said, I want to provide you guys with some examples of how those things actually translate into actual scholarly work. So, when we think about different presentations that one might do, these are some examples, and hopefully, this is going to actually be able to take us. Are you guys still seeing my screen? Did it take you to racism in healthcare? Yes. Okay, wonderful. It's always thrilling when things actually work with technology. And I am technology challenged. So, all right, I'm very excited. All right, so this, for example, was one thing that I ended up doing with some colleagues of mine last month. Is a talk for the AAFP right before FMX. It was a webinar that we did on racism in healthcare. So that was something that I am very passionate about, is the experience of our patients and experience of our colleagues in medicine as it relates to race. And so it became a presentation that we did that is now a national presentation on the AAFP website. And then there was a part 2 to this that was actually a presentation that we did at FMX. So it was a way of being an advocate, but also turning it into scholarly activity. So what are some other examples? So the FCMC, which is the Family Centered Maternity Care Conference by the AAFP, I provided a plenary talk on striving for birth equity, where the conference itself, of course, is about maternity care. But as the closing speaker, we talked about health disparities that African American and other women of color experience when they're accessing healthcare. So it's not, the care of, I wasn't talking about, preeclampsia specifically and the management of preeclampsia and these things that we think of as the more traditional scholarly topics, but it's still something that is extremely important, something that I am passionate about, that I was able to turn into a scholarly work. And here's another example. teaching advocacy to residents and students, introducing training to health policy through resolution writing. So this particular program was able to hold a talk at one of the STFM conferences about how they taught their residents how to be advocates. How do you write resolutions when you go to the Congress of Delegates or the AAFP's, the National Conference of Family Medicine Residents and Students? So they are doing something that is advocacy, but also did something scholarly by making this presentation out of doing that work. So like I said, things that you are already planning to do, you can easily turn into scholarly activity in the more traditional sense. And so we talked about presentations, but how about papers? So of course, here's lots of different examples of how people turn things that they are personally passionate about into scholarly works in terms of papers as well. So in this paper, they were talking about specifically health policy and advocacy and how they trained their residents on that topic. And then this one, so this particular article was about childhood bullying and the implications for physicians. And I included that one specifically because it was so not what you normally would think of in terms of scholarly production. So it's not an article about advocacy. It's not an article about trauma, like dealing with a physical trauma of a child that was, brought in as a trauma alert to your hospital. But it is something that you might be passionate about and then want to be able to make an impact and teach other physicians how to help your patients that are experiencing bullying. So just think of the things that you are really passionate about and how you can actually turn those into things that you can educate others about, whether it be your residents, your physician colleagues, and you can really make a difference in that way. And you can still produce scholarly work around those things that you're passionate about. This one was about medication costs in different countries. And then another one that was about formal advocacy curricula in family medicine residencies, and that was done as a SIRA survey. So there's lots of different examples of how you can turn things that you are passionate about into scholarly work. So the next thing I wanted to talk to you guys about, and I'm going to be wrapping up soon so that we can open some time for dialogue. But I wanted to show how I sort of keep track of all the things that I'm interested in so that I don't forget things, because otherwise I will. All right, are you guys seeing something that says idea being written and submitted? Awesome.
Yes.
So as I come up with ideas, this is the program is called Meister Task, or I guess Master Task. I'm not sure. Um, but I use it for numerous things to keep me organized so I don't forget different things that I'm working on. But I keep, and this could easily just be a Word or Excel sheet that you have, but keep written down ideas as they come along. And then as I move them through the scholarly sort of production process, then I move them until they're completed and then I archive them. Because often I'll be in the middle of something and I'll come up with an idea, and if I don't write it down, I'm going to forget. And the other thing is I get passionate about too many things. As a family physician, that's probably why I ended up in family medicine. I just love everything. And so things that I really want to actually create some kind of scholarly work on, I make sure that I put down the idea, and then when I've moved it into something that I've written, have I submitted it to a journal yet? And if it has gotten accepted, then I'll move it over here. Sometimes it'll stay and submitted for a long time because I might submit it to 2 or 3 different places. And then eventually once it gets accepted, then I'll move it over. And then once I see it actually in publication, then I'll move it to the archive so that you don't have to keep it just on there. So like I said, think about things that you're actually passionate about. How can you turn those into scholarly works? And then make sure that you keep things written down and you move them through the process.